how these body systems work, or the physiology. We understand that as the lungs take air in from the outside, gas is exchanged where oxygen and carbon dioxide are interchanged, and the oxygen then is adhered to the red blood cell and taken down to the individual cells of muscles, tissues, and organs. This exchange of oxygen is very important, as each cell requires oxygen in the process and creation of energy. This is called metabolism. Without oxygen, our metabolism is very inefficient, and we develop byproducts that are harmful. Thus, in anaerobic metabolism, the metabolism of the cell creating energy is less efficient, and the byproduct is lactic acid. In parts of respiration, in order for oxygen and carbon dioxide to be exchanged, we need to have adequate ventilation. This requires the diaphragm to pull down, the lungs to expand, air to pass through dead space areas where there is no exchange, down past the main stem bronchus, through the respiratory tree, and to the terminal end airways, which are the alveoli. At that alveoli, there is a matrix of blood vessels called capillaries, where the exchange of oxygen and carbon dioxide can happen through this very thin membrane. Carbon dioxide is off-gassed and exchanged outwards, whereas oxygen is picked up by the red blood cell and the hemoglobin, and then taken down to the cells in the organs, muscles, and bones for energy production and metabolism. In doing so, we manage by excreting carbon dioxide and also excreting other byproducts or waste products of metabolism. This is written through the components of circulation. The components of circulation include the heart, the blood, and blood vessels. Without the heart pumping the blood through these blood vessels, we would not have the dispatching of nutrients and oxygen to the tissues and cells of the organs, muscles, and bones. It is important to understand that during respiration and circulation, that the amount of oxygen that passes through the lungs is sufficient enough to oxygenate the volume of blood passing through the heart. What this means is that we have to understand what is minute volume and cardiac output. Minute volume is the amount of breaths that you take in 1 minute. Normal adult usually breathes about 12 breaths per minute. 12 breaths is also now used to times that by the amount of air being moved in and out of the chest or the lungs. So as that volume moves in and out, we roughly imagine that it's close to about 300 to 500 cc's. Now, that volume has to be adequate to the amount of blood circulating throughout the heart. And we use another calculation for that, and that's called the cardiac output. And our cardiac output, CO, is the amount of blood ejected, so the volume that is ejected every time the heart contracts. And we times that by the amount of heartbeats, or how many times that heart contracts, so the heart rate. So as we see, our cardiac output is roughly about 5 liters, which is 70 heartbeats per minute, the heart rate, by roughly 70 cc's of stroke volume. So roughly we have about 5 liters being ejected and passed throughout the body as far as blood volume, and we have about 5 liters of air being moved in and out so that we can have this adequate and effective oxygenation and circulation going on. If this is affected and is not allowed, the patient now has poor perfusion or has inadequate circulation and oxygenation to their cells of their muscles, tissues, organs, and bones. We would consider this person then in shock. Blood pressure is regulated through some of these mechanisms. As a circulatory system, blood vessels can constrict and dilate to accommodate for increases or decreases in our blood volume. Likewise, the heart can increase in its heart rate or slow down in its heart rate to decrease the amount that's being pumped out. In its fine-tuning, blood vessels and heart rate work together to maintain adequate circulation and therefore adequate blood volume and blood pressure. Now, as we learn to take a blood pressure, we'll be using a blood pressure cuff, sphygmometer, and our stethoscope. Normal blood pressures run anywhere between 120 systolic over 80 diastolic. So there is a top number or a start position, a start sound, and then as we release the pressure in the blood pressure cuff, blood continues to flow through until the pressure on that cuff is limited and we miss or lose hearing any other sounds, and that would be the diastolic pressure or done sound. So the start sound or systolic number is when we first start to hear those beats. We'll continue to hear these beats until the pressure of the cuff is so loose that we lose hearing any further sounds. That would be when we're done hearing it, would be our diastolic blood pressure. These are written and recorded in a fraction. Systolic over diastolic. Again, a normal blood pressure ranges somewhere in between a range of 120 systolic over 80 diastolic. Understand that your patients may suffer from conditions that will cause their blood pressure to be below or extremely elevated way above a normal means. That is less than 120 over 80 or extremely higher than 120 over 80. So report what you hear and not what you think it should be. For example, patients that have significant blood loss or lack of volume may have a blood pressure that is less than 90 systolic. A person with a blood pressure of less than 90 systolic with other symptoms of feeling lightheaded or feeling like they're going to pass out are probably suffering from what is considered shock or poor perfusion. On the other hand, A patient with a blood pressure high and way above 120/80, for example, a blood pressure of 190/110, may be what they've been registering for quite some time. These people have a diagnosis called hypertension, and in this case, poorly controlled hypertension. Blood pressure is higher than 190 can cause a patient to have a hypertensive emergency or crisis, in which case it may be that the pressure is so high that it is affecting an organ, such as blood vessels of the brain become so overpressured that they may have visual problems and a headache, or there may be a backflow into the lungs, causing them to fill up with congestion and blood flow into the lungs, causing them to have difficulty in breathing. We'll talk about these emergencies later. So please familiarize yourself with the process of metabolism, aerobic and anaerobic metabolism, circulation and the components of circulation, perfusion, and how ventilation and the circulation or perfusion maintains the exchange of oxygen and carbon dioxide. How these blood volumes, the blood vessels constrict and regulate to form our blood pressure. And that someone can be in shock or may have an overabundance of blood pressure, causing them to have the opposite, which is a hypertensive emergency or crisis.